But I'm going to begin. I have just a blank tab here by going to the health department website, which is nyc.gov/health. And we do have a lot of data at the health department that we collect, both proactively and as part of like reporting and administrative data. But this is our home page, and as you can see across the top, there's several tabs. So your entry into finding any of these data resources is this data tab here at the top. And I said this in case you didn't hear me. I have a cold. I've been coughing. I don't sound very good. I apologize. So I clicked on that data tab, and you see here there's 3 sub-tabs, and the first one here says tools and maps. Then we have this data sets, and then we have this publication. So those are kind of the 3 buckets of ways that we provide data to the public. And I'll start here with the publications tab. So this is kind of the way that if we do some analysis, we being the health department, not me personally, do analysis that we want to present. We have several different types of data publications. Obviously, there are people writing peer-reviewed publications. That's another genre. We don't post those at our website per se, but we do have some peer-reviewed within the health department, but they're not peer-reviewed. Data publications called Epi data briefs. We have vital signs publications, which are data plus some recommendations, and we do Epi research reports, which are a little more methodological, and then we have these community health profiles. So I'm just wondering, have any of you ever looked at any of these publications at the health department website or seen them in other classes? No? So the community health profiles, I won't spend a lot of time on this, but just to make you aware, and I think this is a biostats class, right?
Yeah.
So probably not so much in the context of this class, but maybe in other projects that you do as part of your classwork, these might be interesting resources. These are profiles of neighborhoods in New York City, defined in this case by community district. There are 59 community districts in New York City, so there's a profile for each community district. And the idea behind these profiles are to bring together sort of a comprehensive or fairly comprehensive picture of health for each community. So for example, I'll just open the first one here, Mott Haven and Melrose. So this is a neighborhood in the South Bronx. There's a little map of that neighborhood. On the first page, you get this kind of a snapshot of the population. And then you get a little intro from the Commissioner of Health. And this kind of table of contents lays out the different chapters of the report. And then you'll find in the report a lot of different data visualizations summarizing data on the environment that health occurs in, all right? Housing quality, air pollution, the retail environment. So we have in this page tobacco retailers and square footage of supermarket space. And when we have some kind of basic demographic things that are shown to be related to health, education, income, obviously. So, and then you have the more kind of usual suspects, health behaviors, some health conditions. So, and then of course at the end we have data on causes of death. So we kind of go the gamut in these reports. So I'm not going to spend a lot of time on them. I just wanted to show them to you so that you're aware of.
Just realize, sorry. In fact, we're not screen sharing.
So I just wanted to point them out to you as a resource and as a way that you might think about the health of a community in a more comprehensive way. So I encourage you to go to the website and check out the one for your neighborhood or neighborhood that you're interested in. And this I got to, again, it was the data tab, publications tab, and then over here on the left, there was a little link to community health profiles. And the other types of, go back one level, publications I mentioned, you could find by searching for a topic that was interesting and see if there's a data publication on it, or just look at, you know, everything that's been published under that series title. So for example, we have these Epi data briefs. You click that and you push search and it gives you kind of a reverse chronological listing of data briefs that we've published. So here's an example of one that just came out last week, which a colleague did an analysis of our community health survey data, and we're going to look at more of that data in our interactive tool, Epi Query. But she did a kind of more in-depth analysis where she combined multiple years of data and then looked at not just sort of people whose race was defined as Black, but within that group by country of origin. So US-born Blacks versus Black residents of New York City born in other countries that have emigrated here. And there's some limits to the analysis. It, you know, it doesn't account for how many years people have been here and the effects of acculturation, which we know can, you know, there can be a lot of difference if you've been here a year versus 15. But, you know, looking at some of the health outcomes in those US-born Black New Yorkers versus other countries of origin, and also teasing out a little bit of differences between SES, so high income and higher education level versus lower income, lower education level. So it's an interesting analysis, and there's some summary of the findings here, a little graphic. This one's a little text heavy. And then most of the data briefs also include these data tables appended to them. So then you'll see in more detail, like what were the actual estimates, excuse me, confidence intervals, results of statistical testing that the analysts did. So again, there's a lot of different topics here. Sometimes they're data that we provide in other ways, but they've been analyzed and put into a report form. Sometimes they're data that have been collected for a very specific reason and aren't provided in any other way but here. So for example, you find something, I don't know if this was ever provided in another way, but neighborhood-based rat surveillance. So, you know, our environmental health division has a program where they go out and they they go block by block and they look for certain signs of rat activity and they index it. And then they work with building owners to say, like, hey, we see these signs of rat activity and here's what you can do to abate the problem. And then they can go back maybe a year later and see what's going on. So instead of just kind of waiting for people to call 311 and complain about rats, they initiated this more proactive program to actively go out and kind of assess the environment and try to work with property owners to address the situation. And that's not the kind of data that, you know, is easily accessed, so it's kind of summarized here for people. So I don't want to spend too much time on the publications, but I did want to, there's a lot of different data publications here. The Epi data briefs have the data tables with them. The other vital signs publications don't, but there's similar kind of assessment of, or summarizing of a data analysis and then recommendations related to policy that would come out of those data. So go to the website, check out the publications. Yes?
I'm just wondering, do you have a sense of like who uses like some of these publications, like journalists or
journalists are interested in them. They always have to have a story. Actually, the one that was at the top of the list that just came out last week about health of Black New Yorkers got some press coverage. That there was one a few weeks ago on biking in New York that actually got a little front page on the AM New York. So journalists look at them, but it really depends on the topic. My colleagues in the alcohol and drug use bureau within the health department regularly do data briefs summarizing drug overdose deaths, and with the sort of ongoing problem with opioid use and overdose deaths related to opioid use. They have used this format to put data out and work with their partners in the community who are trying to address the problem. So they're working with community-based organizations that are working on a specific problem. So that's another example. Sometimes policymakers, maybe city council people, they need to know about something that they're not experts on health, but they can read one of these and kind of get some background information if they have to vote on legislation or whatever it might be. So I think there's a varied audiences, not so much the general public, but professionals working on health, I guess. And then I'm gonna, I know I only, how much, what time am I going to?
I figured on half an hour, so
like
like 15 minutes, but
yeah.
we're flexible.
Okay. So back to the this first tab that says tools and maps. This is where you would access a couple of different interactive tools that we provide. One of them is called Epi Query, and has anyone here used Epi Query? No? Yes?
I looked at
You looked at it.
It has like a lot of data in it.
Yeah, it does. So let's take a look at Epi Query. You can, again, go to the Tools tab here. You can click this little link in this bulletin list or over on the side, either one. Or you can type www.nyc.gov/health/epiquery. So that takes you to this index page. And there are 3 tabs here. There's this main page, this home page. There's a little summary tab here, which, so say you're interested in a topic, but you're not really sure where to find data related to that topic. This kind of gives you a listing of what data sources are included in the tool, and then below a kind of just a topical list with a little indicator of which data source you would access those type of data from. And then say you walk away from here, I gave you this little demonstration, you don't remember, how do I do that? This FAQ tab kind of gives you step-by-step instructions about how to use the application. So I'll just go ahead and scroll down and jump in here. So this application has a lot of data, as your colleague said. It's organized by the source of the data, which is, we understand, not super intuitive if you don't work at the health department. So we're actually right now undertaking a plan to revamp this, and we're hoping to have a more topical organization because we think that's more intuitive to people, but for now, this is the way it is. And we kind of have 3 types of data. We have our survey data, which I'll come back to, they're surveys, our surveillance modules, and these are largely data that are derived from disease reporting that the health department collects information from labs and physicians in New York City that are required to report on a number of communicable diseases. So we collect a lot of data related to those reportable diseases and make them available through these different modules. And this one, syndromic surveillance data, is a little bit different than those. This isn't reportable data. This is instead data that are collected from emergency departments around the city. And different syndromes are detected, I guess I should say, by looking at the chief complaint of somebody walks into the emergency department and they say, oh, I'm coughing, I'm sniffly, I have a fever, I don't have a fever, but say they had a fever, they would say, that might be flu. So I just opened up the module just to show you what are these syndromes. So they might say, oh, you have an influenza-like illness based on your symptoms, and we want to keep, get an idea of how much influenza-like activity we're seeing in the city. Is there a spike? Well, if it's February, we might expect to see a spike in people showing up for this kind of illness because that's when it's at its peak. If it's April or May, we might say, wow, what's going on here? We need to investigate this more. So that's why these data are collected and looked at. In the interest of time, I'm not going to go into that right now. And then so we have the surveillance data, and then we have what we call our administrative data. These are essentially data that are collected as part of issuing birth and death certificates in the city of New York. And all of the different data sources have these little information tabs here. So going back to the syndromic surveillance, if you click on the information tab, you'll get a little bit more information about how the data are collected, definitions of the variables that you'll see once you go into the actual data module. So for each one of them, I encourage you to look at the information tab. So I'm going to go back up here to the top to the community health survey, and we're going to take a closer look at this module that's part of the application. And to get into the actual data, you click these links here. So, so has anybody heard about the community health survey? Somebody's nodding. You don't count. That's good. What do you know about community health survey? Anything?
No.
Oh. Have you ever heard of the behavioral risk factor surveillance system?
Yeah.
That's this federal survey that's done at a state level, the BRFSS. So this is like our New York City local version of that survey. But it's a survey that's done every year of adult New Yorkers by telephone. And it asks a bunch of questions about health behaviors, health conditions, mainly chronic conditions, access to health care, just a real range of things. So this is the kind of thing when I said back in the beginning, like maybe you're interested in a topic, but you don't know by looking at that index page that you're going to find out about some of these things by looking at community health survey because you don't know what's there. So obviously, if something's called tuberculosis data, okay, you know you're going to find out about tuberculosis. But some of these other things you don't know. So that's why I would say go look at that summary for the topic that you're interested in. So we have data here in this module by year, each single year. It's been collected since 2002. A lot of questions are repeated year after year, but there are changes from year to year. Different questions come onto the survey, drop off the survey. But some things are always there, like self-reported health is always there, smoking is always there, physical activity. And then hopefully in the next 3 weeks, fingers crossed, we'll be adding the 2015 data here, which is the most recent year. But is there, so here's a list of indicators included among these data. Is there a topic that somebody's interested in knowing more about? What?
Something under physical activity or nutrition.
So we have
Walking, biking for commuting. That's interesting.
walk, bike for commuting. So, okay, so you go here and you're going to click a radio button to select the thing you're interested in, and you see that you get a little pop-up there that tells you a little more about what this indicator is. So you would click the thing you're interested in, and then you go down here to the bottom and you click this little submit button. And it runs a query. And you see at the top, you get a little explanation. Respondents were asked how they usually got to work or school on weekdays from 9 to 5. And results were restricted to those adults who spent weekdays 9 to 5 at work or school. So if somebody worked the night shift or only on the weekend, they were included in this question. So about 15% said they walked or biked only, which is actually pretty high. And then another 8% said they walk or bike along with other modes, like a bus or subway or driving or whatever. And then a large portion said they don't walk or bike. That's not how they get to work. So
That number of adults is estimated based on a sample.
exactly. So this is an age-adjusted percentage, age-adjusted to the US 2000 population. And the estimated number of adults is based on the sample.
How big is the sample usually?
It has varied from year to year a little bit, depending on budget cuts. It's usually around 9,000 people. There's been a year or two where it was slightly less, and that's challenging to get good, robust estimates. Not at a citywide level, that's no problem. But some years it's been up to 10,000. So
The participants are like compensated.
they are not. That's not true. Actually, about 2009, I started doing a partial cell phone sample. It used to be all landline based. So those people who are sampled from the cell phone and do the survey on their cell phone are compensated for their minutes, basically. Although we are kind of thinking about doing a compensation for everybody. But no, it's out of the kindness of people's hearts that they spend 20, 25 minutes on the phone doing our survey. So these are the overall citywide results. Again, I said this was an age-adjusted percentage. You can also get unadjusted results. You could choose that back out at the index where we first made the choice, or you can choose to look at the CRE results. Here is just toggles back and forth. So you'll always get an overall result for each level of whatever the variables that you selected in a little table like this, and you get a little bar graph, which, you know, if you were doing a report or something, you could just kind of copy and paste. And then you have the option over here on the right to refine these results. So you can select one or two demographic or geographic variables from this drop-down list, or you can look at by neighborhood, and I'll talk to you a little more about neighborhood definitions. You can look at by district public health office area, and I'll talk to you a little more about those too. Or you can cross it with another one of the questions. So there was that whole list on the page before. You can cross it with one of those questions. So maybe you wanted to see how does walking or biking, you know, look with, I don't know, having asthma currently. This is probably not the best choice. It's going to be too small, but you would make your choice. You click submit, and again, you got the definition of the two things you selected, and you get a little bar chart and a table below it. And then you'll see in this case that there's a couple estimates there in red with an asterisk. What does that mean? So these are survey estimates, right? They're based on a sample of New Yorkers and then kind of weighted up to the population of the city. So when we start breaking things down to these smaller levels, it gets a little less reliable. So all of the survey data are put through this kind of algorithm to see what the relative standard error is, what the underlying sample size is, and that sort of thing. And then depending on the relative standard error, it's mainly to do with small sample size. If the estimate is deemed to be potentially unreliable, we put a little flag here and put it in red just to notify users of that. So what does that mean to you? That means that, you know, interpret with caution. These are the best data that we have, but they're, you know, potentially have some error there. We would say, like, try to look at it over a number of years to see how things have changed over time, and just kind of interpret with caution, I guess. If it was too unstable, it would be suppressed. And there's a PDF here that explains the way that the data are analyzed for reliability. In this case, you can also reverse these columns and rows using this button. You can look at the crude estimates again if you wanted to. You can download these as a CSV file as well. So let me go back to this level. So let's say we want to look at some demographic factors. We could choose one or two of these. If you choose one, you'll get a little bar graph. If you choose two, you'll just get a table. But I'll just go and look at the neighborhood here too. So how do we define neighborhood? I don't know how much looking at sub areas of New York City you've done, but
Zip code.
it's very complicated. I wish somebody a long time ago could have just come up with one way and then we all would have used it. It's so aggravating. So we use this, this geography that we refer to as United Hospital Fund areas. So these are groupings of zip codes. And there's 42 United Hospital Fund areas. They were originally created by the United Hospital Fund, which is like a consortium of hospitals in the city, to do like needs planning for hospitals. But the health department adopted them when it started the community health survey back in 2002 because it seemed like, you know, just kind of the beauty of it is you get somebody through the kindness of their heart who's going to participate in your phone survey, and all you need from them is a zip code. And most people are pretty comfortable giving you that, as opposed to, can you give me your full address? You know, people don't want to do that. The problem has been that nobody else uses this geography. So it's been very frustrating for going back to the, earlier question about who uses these data. Community-based organizations, maybe they need to write a grant or report at the community district level, at a sort of political boundary level, and they don't match up exactly with these. So we have been working the last couple of years to try to ask people to report either their full address or the nearest intersection to where they live so that we can geocode them and derive estimates at a community district level from the community health survey. But we don't have that quite yet. So what you get now is these United Hospital Fund areas. And for 1 year community health survey data, some of them are combined, so there's only 34 neighborhoods here. And then for each level of this variable, there's a tab here. So right now this map is showing us the walk and bike only, the walk and bike with other modes, and the didn't report any walking or biking. And below that, you'll get a table of the United Hospital Fund neighborhoods. We see quite a few suppressed and flagged estimates here, because now when you're really breaking things down to these small neighborhood levels, it does get a little more unreliable. There's also a link here to a PDF if you want to see more detail about how these neighborhoods are defined. So any questions about the neighborhood boundaries, the United Hospital Fund boundaries? Yeah.
It's just interesting, you mentioned earlier that the community district, that's like a different geocoding breakdown, right? Under the Epi briefs.
The community health profiles.
Community health profiles.
Those were done at community district. There are some community health survey data in there. 3 years of community health survey data were combined. About a third of zip codes in the city fall completely within the boundaries of a community district, but the other 2/3 overlap 2 or more community districts. So the zips, those people in those overlapping zips, where their community district was imputed based on other characteristics that we could derive from the survey. So we have this one data set where we have community health survey data at the community district level because it was imputed. And then from that point, we started asking people to give us more information so we could geocode them. And then we're hoping next year to have another data set with the community district geography in it. But those are kind of the 2 main geographies that we're dealing with now. There's another geography that's You'll see some data. You'll never see this community health survey data at that geography because we would just have to collect way too much data to be able to do it. But there's a geography called the neighborhood tabulation area, and these are like combinations of census blocks. So there's like 280 census blocks or something like that in the city of New York, and it's combining them. So I think there's about 160 neighborhood tabulation areas to provide some smaller neighborhood data, but still at a level that protects confidentiality of residents in those small areas. But I'm digressing. So that's community health survey. There's a lot of data, a lot of different indicators there. And you know, as I said, some of them are repeated from year to year, but there are some years that things were kind of asked as a one-off, or they don't ask them every year because they don't need to ask every year. Like this body piercing was the first time that was ever asked. And not sure if it'll be repeated anytime soon, but it was just try to get a, you know, there's some of these issues, like the health department has jurisdiction over regulating places where you can go and get your ears pierced, but they have no idea like what is the prevalence of people doing this and how do we kind of get some data around this thing that we're supposed to regulate. So they'll try to put it on our population level survey. So, but it's not something we need to track every single year. So, so that's a community health survey. It's done every year. It's about adults 18 and older. I did want to just briefly, I've gone past my time, sorry.
Okay. I guess I should let Tony say.
That's okay, don't worry about it.
Mention some of the other, so we have some survey data about children 0 to 12 in this child community health survey module, and we are about to add some more data from a survey that was done in 2015. And that's been a challenge to get data, population level data on that age group. So we're planning to do more regular survey data collection about that age group. There's a youth risk behavior survey, which is done every 2 years among high school students. So that's kind of the high school age New Yorkers. The NYC Health and Nutrition Examination Survey. Has anybody heard about this survey? It's modeled on the national NHANES survey. So it's participants take a survey, but they also provide samples, blood and urine samples, and you might have done like a swab or something too, and then some measurements, you know, height, weight, waist circumference. So it's a really rich source of data in terms of having these kind of objective measures from samples as well as the survey data to complement it. And then the other that I mentioned earlier is the birth data and the death mortality data. This is a really also a really rich source of data. So mortality you can look at by leading causes. Again, you have all the, you know, by single year, you would say, oh, I'm interested in looking at, you know, the different leading causes of death. You would make that choice and click submit, and then you would get a table like this with the numbers and rates, and again, you can break it down. So all the modules kind of have this similar setup where you click submit and you get an overall result, and then you get the option to refine it further. And you can download the CSV files for any table that you generate once you're in there. So I've gone way over. The only other thing I did want to point out is this data sets tab. There are some, this is not a very well organized page, I'll be honest, because some of these are just like links back to Epi Query. But I just want to point out community health survey and youth risk behavior survey, and I think the NHANES survey from 2004. There are data sets posted that you can use. So if you click on that community health survey link, you'll come to this kind of overall explanation. And then there's this tab here that says public use data. So there's a lot of information about that you should keep in mind and supporting documentation if you were to do original analysis using these publicly available data sets. But there's all the info here, read through it, and then you go down here and you can download the actual data set. It's a SAS data set, some sample code and formats and all of this, code book, questionnaire, data set. So if you wanted to dive in and do some original analysis from the line listed